everyone, welcome to our show, Talk About It. And the question still is, why don't we? Why don't we talk about a million things that go through our minds every single day? My name is Arpit, and today we're going to take the conversation further on the topic of mental health. And we have our guest here, Dr. Nayan Soni, for that. Dr. Nayan is a psychiatry registrar and here with us to answer a few questions. Welcome, Dr. Nayan.
Thank you for having me, Arpit. And also a big congrats on this venture. I think it's awesome what you're doing.
Thank you so much. So we're going to start straight away.
Yes.
Why do you think it's on the rise, the mental health illnesses like depression and anxiety and sleep disorders?
Well, that's actually a very good question, and we're trying to work that out ourselves in mental health, whether being able to understand it better and people talking about it more is a partial reason why the rates are increasing or to that effect. But to be honest, the ongoing research is showing that it's a lot of factors that are determining why mental health problems are on the rise. So, and it also depends on the stage in someone's life as well. The imbalance that can occur from a lot of different factors, whether your general health, your mental health, your social health, your cultural health, and maybe even your spiritual health as well.
That's true. So, Dr. Nayan, what are the triggers and what are the common factors why people go through mental health illnesses? Is it social media, or what do you think it is?
Well, again, it's very much determined on the individual. And this is the thing about mental health, because mental health is very broad. We're looking at biological factors or medical factors. If you're looking at psychological factors or the way people think and feel, and you're also looking at social factors, like, for example, the relationships or cultural factors. So any of those things could be potential triggers, where I like using the pregnant mother example, or the mom that's just delivered, because that ticks basically all of those boxes.
Yeah, we actually use this example in one of our other interviews.
Yes.
The lady sitting here, she went through that herself.
Yes.
And she said, when I was pregnant and when I gave birth to the baby, everyone was just talking about the baby and no one talked to me about myself. That's how I am doing. So that's, I think, really...
That's right.
Yeah.
That's right. You spoke about triggers. Now, I know there are a lot of Indian migrants that are living in Australia or in other Western countries. Sometimes their children are still in India or wherever they were originally. A mother who's studying, trying to make the financial, stressing about maybe visa requirements, all these things. So there are multiple triggers.
It depends on each person's life.
It does. It really does. And the point of having a mental health assessment is to be able to understand why here and now the person is demonstrating features or signs of a mental illness.
Okay. So talking about visiting a psychiatrist or just getting medical health.
Yes.
Why do you think they don't go to a psychiatrist, or they just don't talk about it in general? So why do you think is that?
The reason is stigma, or stigma about mental illness or mental health. What it extends to is people with mental illnesses, mental health problems, being discriminated against or prejudiced against people with mental illness.
Yeah.
So there's a fear because of a lack of understanding around mental illnesses. I think very important because many people still don't understand that it's, if someone has a chest infection, then they go get treatment for that.
Exactly.
And it's not seen the same way if you have depression or anxiety. And we know that when people understand it better, they get better.
Exactly. That's what we talk about in every episode of our show. Just normalize the fact that mental health is a real illness and it can be treated, can be cured, and we have to take steps towards it.
Yes, that's right.
So just wanted to understand, Dr. Nayan, what are the differences? What's the difference between a psychologist and psychiatrist?
Good question. So I'll talk about psychiatrists first. So a psychiatrist is a medical specialist, someone who has done training specifically in psychology. They don't prescribe medication.
Exactly.
Yes, that's right. And a psychiatrist is commonly involved more so in a diagnosis.
So, Dr. Nayan, within my friends, and I asked what kind of questions would you like to ask from Dr. Nayan. So, one of the questions is how and when does a person is supposed to know that he needs a psychiatrist? Yeah.
Sure. It's really dependent on the individual and their supports as well. There could be, again, many triggers for that, including even substances. The change from what they're normally like affects their functioning. So, for example, a mother may not be able to look after her child or new baby as well if she's going through, say, a postpartum depression.
Yeah.
You know? So it's very, very individual. But most importantly is being able to recognize that, yes, there is a change. And again, Arpit, it's not always black and white either, because even things like infections or medical conditions can make people quite low and down in the dumps.
But that doesn't mean they're going through depression,
Not
right?
necessarily,
So
because it usually shifts and
exactly,
goes
yeah.
away. So it depends on the context as well.
So it's just a persistence of that feeling low.
Yes.
If it's happening for a long time, then you might go and see a doctor.
Yes,
Okay.
and someone who has mental health training can help ask those right questions to help determine whether or not this is just on a spectrum of normal human suffering,
Yeah.
or if it's crossed over into something a bit more serious. Okay.
Perfect. That's a really good answer,
Thank you.
Nayan. So another question that one of my friends asked is how do you keep a balance of your emotions when it comes to your personal and professional lives?
Okay, that's an interesting question. I think sometimes they help each other. So sometimes when you're working, you can sometimes listen to your intuition and your emotions and things. But I can appreciate a time where too much emotion in your professional life may be counterproductive.
The friend who asked me this, she works with some social work organization. So
Okay.
she works with the children who are
Yes.
not living with their parents,
Yes.
and they're not well behaved most of the times.
Yes.
So I think that's quite stressful
It would be.
profession.
Yes.
And to not let that affect her personal life,
Yes.
I think she's struggling with that.
Yes. So if she is struggling, it's really important for her to know that there are people that she can talk to. Typically, a respected and trusted senior is a really important person to link in with in these
So
particular.
it doesn't have to be a psychiatrist or a psychologist.
No.
It can just be a friend or
Yes,
a
that's right.
senior or just your partner, right?
Yeah, it's something we even do in psychiatry and in psychology. It's called peer review or supervision.
Dr. Nayan, that's a wonderful example. We would love to have a story from your side about someone who went through depression or anxiety or any form of mental illness,
Sure.
and how they overcame that, get encouragement to talk about it.
Sure.
Yeah.
An example that comes to mind is when I was working in an inpatient mental health setting. There was one particular 25-year-old man from India, and he was profoundly depressed to the point where he stopped eating and drinking. And his family believed that he was being lazy. They also thought that maybe God was punishing him. So they have their cultural view on what was going on.
Yeah.
And this is something that many people from different backgrounds believe as well. It's not necessarily just Indian families, but this particular case it was. So what happened was we used what's called transcultural mental health services. We were very lucky to get a Punjabi clinician who was able to work with the family, work with the patient on multiple occasions throughout his journey in the inpatient sector, in the inpatient setting, help them understand what was actually going on, that he had a severe mental illness and that his life was threatened, from not eating and drinking. And that really helped him improve, along with the psychiatrist's recommendations on what medications to take and other treatments. And after his time in the inpatient setting, he was then transferred to the community setting. So the person got better fairly quickly as well. started eating and drinking quite quickly when they were in the inpatient setting. Their physical health improved, and then they were able to be discharged.
Yeah. So I'm really glad the person is okay now.
Thank you.
So Dr. Nayan, talking further on the topic of resources, especially for international people, international students living here who are not actually permanent residents. So what are the resources available and in terms of costs, which one are easily accessible without much investment?
Unfortunately, I only have a limited understanding about what services are available, but on discussion with this very issue with transcultural mental health services, they are well experienced in being able to guide the person or the person's family. And it's as simple as just Googling them. So if you transcultural mental health, they're a statewide service. So whether you're up north in Cairns or Townsville or on the Gold Coast, they have people stationed to help. I think that would be the best avenue. And the resources of transcultural mental health are vast. As I mentioned earlier, they have a lot of trained clinicians in different languages. So in university, quite commonly there are student counselors or counselors for students rather, that can help at a first line basis for university students as well. So it's really important to seek help early before it impacts the person or families through the ripple effect too severely, I should say.
So Dr. Nayan, concluding the talk, why do you think it's important to take mental health seriously and what are the changes we can make to our lifestyle to live a balanced, mentally healthy lifestyle?
It's really important to take one's mental health just as important as one would take one's physical health, because they are very much interlinked. So sometimes, like when, for example, someone has a fracture, they need a cast, it's very important to get the cast on as quickly as possible. And because if you leave it for too long, it might affect the way that the bones heal. So similarly, when someone has a mental health issue, it's really important to get in as early as possible to prevent the very, very difficult consequences that can occur. The second part of the question in regards to living a balanced life, I think, is one needs to look after, you could say, some of the basic things that you would do, like, for example, getting enough sleep, a balanced diet with protein and carbohydrates and fats and those sorts of things is important. So nutrition. And then exercise, 30 minutes of exercise
every day
of moderate intensity. And the other things that are important are healthy relationships. A lot of stress can occur from people having relationship problems or having gratitude for the things that you have. And that has been shown to be very powerful in shifting some of the negative thoughts that sometimes we can have. So those sorts of things. So this is in the realm of what's called positive psychology. However, sometimes these things are not enough, and the more serious conditions need more specialized treatment.
And do you think meditation should be a part of our lifestyle as well?
Yes, I do actually. I mean, I've practiced it myself for many years.
I started recently too.
And the science is showing how you have lower levels of stress hormones. Your body's parasympathetic nervous system, which kind of governs the rest and digest, is a little bit more in control rather than being too stressed and too hyper, you could say. Your blood pressure goes up and those things. So meditation helps to help neutralize some of the stresses that modern day pressures put on us.
Yeah. Thank you so much for your insights.
Thank you for having me.
It was an absolute pleasure having you here.
Thank you.
Thank you so much.
Thank you. All the best.
Let's face it, we don't openly talk about a lot of things, but have we ever wondered, why don't we? This show is all about that. Please like, share and subscribe the video if you liked it, and donate whatever little you can through the link below. Thank you.